we had 23 patients so far that we've reported on. We have about, I think, 4 more that have been treated that, we weren't able to report on at the time of the presentation, but 14 of those patients had D. diff liposarcoma and were randomized equivalently. And then 9 patients in the UPS arm. The most exciting findings are in the UPS arm. So in those patients, there was really no difference between Nivo or Ipi-Nivo, except that there was more toxicity in the Ipi-Nivo group, which is not surprising. But in terms of efficacy, the majority of patients, so 8 out of 9 patients, had less than 15% viable tumor on their surgical specimens, which is really exciting. We had looked at our own historical data before we designed the study to see what was sort of a median for either radiation or chemoradiation alone. And another group from Boston had done it as well. And the median for radiation for the amount of hyalinization is about 5 to 10%. And in this study, the median was 90%. And so this was, although it's not a, we don't have a radiation alone group, using historical cohorts, the amount of hyalinization in the UPS patients is way better than what we've seen historically, which is really exciting. So, and in the D. diff liposarcoma groups, we don't have as much historical data on those, but the median amount of hyalinization in those patients was around 20 or 25%, so not nearly as much. But definitely, potentially this could be an alternative for things such as chemo and stuff where patients, we don't honestly have a lot of really good treatment for dedifferentiated liposarcoma anyway. So potentially this could be something that we could incorporate at some point.